Welcome back to Morning Break and this week's Monday Motivations brought to you by Gates Brain Health. We have Dr. Randall Gates joining us now. As you all know, he is a board-certified chiropractic neurologist and chiropractic physician. And today we are talking about the chronic pain epidemic here in America. Thank you so much for being here and for tackling this topic. It's a big one, especially when you throw in the word epidemic. I mean, that sounds huge. And so I'd love to kind of have you break it down for us. And what do you mean by that?
What I mean by that is that it's really, really common. So estimates are between 11 and 40% of American adults have chronic pain. So that's a significant number of the population. In 2016, the CDC further reviewed the data and they said it's 20% of the American adult population, which at that time, somehow they classified that as about 50 million Americans. Wow. Other estimates I've heard are higher, but anyways, that's a lot of people living their lives in chronic pain, not getting answers. And if they're not getting answers, I think we should talk about it. Of course, I'm not anti anything, but there are maybe blind spots in our current healthcare system where maybe we're not getting the results that we want to, and so maybe there's a nutritional or other cause that we can start exploring.
Yeah, and when you talk about pain, what kind of pain specifically? Back pain, headaches?
Yeah, it could be any type of chronic pain disorder, from back pain to headaches to neuropathic pain, peripheral neuropathies, things of that nature. Back pain is the most common type of pain, but migraines are really, really common in young females, as we've talked about in other broadcasts. So, yeah.
I know, it's something I was dealing with this weekend.
Oh,
it was
really?
Awful.
Oh,
yes,
my heart goes out
about
to you.
all day Saturday. It got to the point where I was like, throwing up. It gets really bad. And I'm very fortunate that it's, it usually only lasts 24 hours because I have peers who, they can get it for days, if not weeks at a time.
Right, exactly, exactly. Oh my goodness.
Yeah, so when we're talking about chronic pain, living with chronic pain is something that you do not want anybody to deal with. And when you kind of combine your neurology background with your chiropractic background, now we start talking about what are some of the triggers and what are some of the relief that can be out there. And a lot of it can come down to diet. So diet as triggers, what are some things that you're finding?
Well, I think a simple way for most people to think of it is that we are what we eat. Right? And so when we take an anti-inflammatory, those anti-inflammatories are blocking inflammatory cascades in our body. Well, there's a lot of evidence 10, 15 years ago that the foods we're eating have inflammatory fats in them. Those inflammatory fats become our membranes of our cells. And if you hurt yourself, well, then are you going to have more inflammation because of the fatty acids that we're consuming, as an example. So that's where fish oil, many years ago, I think it was the neurosurgeon of the Pittsburgh Steelers did a study where he took chronic pain sufferers, put them on fish oil, and 80% of them got off their daily use of non-steroidal anti-inflammatory drugs.
That's so interesting.
Super interesting. And then there have been other studies looking at low back pain patients. They found that if they put them on a gluten-free diet, like 56% of them got off their anti-inflammatories as well. So I'm not saying that gluten is the cure, or gluten-free diet is the cure, or fish oil is the cure, but just to note that our foods do impact our inflammatory levels. They can.
Yeah.
And certainly it's complicated. Certainly we can have people who've kind of abused their body through different sports or work, and so they have arthritis, other people have neuropathy, other people have migraines, but foods are a big component, I think, that are being overlooked.
And I think what's really important too to note is that everybody's different and everyone processes food differently, which is why coming to you and going and being like, hey, what is it that my body is doing with these foods is so important, so you can give that individualized approach to healing.
Yeah, I have 9 different food plans I work with, so a lot of patients are confused because they find out what diet I'm on, and they're surprised that I'm not putting them on that. And so, so anyways,
so if people want to get more information specifically about maybe some of their chronic pain and how diet might play an issue, where's the best place to go for that?
They can go to gatesbrainhealth.com. I'm putting out YouTube videos every week, my YouTube shorts. I'm doing 2 to 5 a week, so I have a lot of content there. They can call 775-507-2000 to do a free consultation with me to go over their case. So we have a lot of avenues for people to acquiesce information or to sit down and chat with me.
Yeah, I think that's wonderful. And like I said, I know the chronic pain epidemic is a very big topic. It's something that we will probably talk about for many more segments to come in 2024 because we can break down it even more and talk about specifics as well. So thank you so much, Dr. Gates, for being here. We appreciate it. Thank you guys for watching. We'll be right back after this quick break.